and see what happens. Okay, so Sarah, thank you very much for agreeing to this little practice run. I really appreciate it. So here we go. 2020 has been a year like no other. The purpose of this semi-structured interview is to explore your views on the roles various forms of media has had on you personally in terms of processing and reacting to the evolving news of the pandemic. Does that sound fair enough?
Yeah.
Okay, cool. So what were your recollections of when you first heard about COVID-19?
My recollections, well, I started my maternity leave in February, so that was right at the beginning when the first information from China came across. And I remember sitting on the sofa with my husband watching BBC News, and they highlighted the fact how many people will be off sick and how many people in the public sector won't be able to work, which at that point wasn't believable to us.
Yeah.
Due to the increasing pressures, I then had a WhatsApp group with all my extended friends and family from all over the world, as I was the only person who had time to look through social media and stuff. I then filtered all the important information from Twitter, BBC and news channels and distributed it in that WhatsApp group.
Wow, I had no idea. Do you still have the WhatsApp group?
Yeah. It was, first of all, it was called How Not to Die, based on the book.
The book by Michael Gregor, or his name is. Okay.
Yeah. But I was criticised for my negativity, so it was changed to How to Survive. But it was a great resource because I basically was the only one on Twitter. So I had all the important trials and papers and stuff, which I then kind of translated into more lay terms to my family and friends. I've also written like a summary in the first couple of weeks of what the information out there is of COVID. And during the first 3 months of the pandemic, I've written sort of a summary paper about COVID, which hopefully will be published at some point if it's still up to date.
How fascinating. So I'll come back to that. That's tangential thought, but I need to keep on this. But that's really interesting. I didn't know that. But okay, I want to come back and pick that up, so I might write it down. The question is, what source do you use to get what sorts of media do you use to get news around this? You mentioned BBC, you mentioned Twitter. Can you talk a little bit more about those two sources?
So BBC, I've got the BBC News app because due to the small children at home, I don't manage to watch the 10 o'clock news, and also the fatigue that hits about 10 o'clock. So I use the BBC News app to just tune into the news whenever I can and try to keep up to date. Although I did reduce that sort of mid-lockdown due to the negativity radiating into my happy bubble at home. So I mainly focus on Twitter.
Really?
Yeah, so my main information source is on Twitter, and I've done that actually before the pandemic, and all the sort of new papers that come out will be sort of posted on Twitter, and then you come to work and people talk about that new paper, and first you were like, oh, I don't know anything about this paper, and then I started being on Twitter. I was like, yeah, of course, I read the paper. It was published on Twitter yesterday. So I think that's Twitter's a very good way to keep up to date with medical stuff, because everything is posted on Twitter on time as soon as it's published.
Okay, thank you. That's really interesting. And going back to your group, How Not to Die and then How to Survive, you said that was members of, was that friends and family in that group?
Yeah, so basically all my friends, so both English and German people, as well as family, so reaching to America, and they didn't have anything to do with each other. The only connection was me, but we all posted things, of course in English, but I was the main person sort of transmitting the information to them. But we had good insight into what's happening in America and what's happening in Germany, because obviously Germany and Italy were a bit ahead of the curve at the time, and then the people in America then sort of knew what was coming.
Yeah, wow, fascinating. And the people in those groups, were they medical and non-medical then? Was it both?
Yeah, both. So the UK people were mainly doctors due to my social circle in the UK. But well, having said that, most of my family is medical as well, but about 50-50, I would say.
And then how did you find, in terms of putting the you said you were translating the information for a more public sort of audience. How did you find that in terms of how was that received? Was it received well by doctors in terms of this almost lay summary of what the paper said or what the latest reports on the subject was? Or did you get engagement from them as well?
Well, I did. We sort of screenshotted the main graphics of the paper and the title, so people who did have medical background would sort of be able to source the information themselves, but then translated they'll interpret the graph for people who were non-medical and said what that does it actually mean for us. Okay,
fantastic. And what was the first country you heard was affected by COVID-19? I think you mentioned China, didn't you? So you heard about that. You had the opportunity to be ahead of that because you saw it on Twitter, presumably.
Yeah, I can't remember. It must have been beginning of January, but I have to say the sort of lockdown did take me a bit by surprise because I did, as they assumed it would be. So the fact that the supermarkets were empty and I was having a 4-week-old baby and there was no baby milk at the time. So I was informed, but I wasn't prepared for real life, let's put it that way.
Really? Okay, so the line dipped out a little bit there. So tell me that bit again. I got a bit about shopping and 4-week baby.
Yeah, so I said I was informed about the potentials and prepared for what they anticipated was going to happen. But in real life, it might have been the fact that I was totally sleep deprived, but the fact that in real life, it didn't really translate into actions from my side because I ended up having no baby milk and the supermarkets being empty of baby stuff. So we had to source some stuff from other areas. So that took me a bit by surprise.
Okay. Fair enough. And when you first heard the news of COVID-19 in China, how did that news make you feel? How did it affect you? I mean, obviously you've said what you've done in terms of your friends and family in a WhatsApp group, and you've almost done what a doctor would do in terms of a very proactive front foot, doing something to help make things better. But from a personal perspective, how did it make you think and feel?
I've got a very positive attitude to life, so I thought whatever's going to happen, we're going to get through this. On the second hand, I had a newborn baby, which was my highest priority. So of course we were fearful and we were anxious, and I did separate from my husband the first 3 months of lockdown to keep the baby safe. So both children safe. So he was alone, working and living in a separate house to us.
Wow.
So that was our consequences, and I think that was driven by fear retrospectively, although now we're living together and having much more significant challenges locally.
Wow. And you say driven by fear. I was going to say, was that on the basis of any advice that you'd received either from the UK government or other governments that you've come into contact with? Because you're not the first healthcare professional that I've spoken to about this who took a really high infection prevention control approach to this.
Well, I think at that time we had to assume the worst, and although the first wave was retrospectively not as bad as it is now, nobody actually knew the transmission. We didn't have PPE, no vaccination, of course, so there was very little to protect us apart from the fact of staying away from each other, which we did. Wow.
So that was, you preempt. I love it when this happens. It was, did you change any behaviours on hearing the news? If so, what? So thank you, that's very good. You're really well suited to answer this one, which is, how did your views vary as compared with your friends and family?
Well, I have got a large sort of many months of intensive care experience, and I have seen simple health issues like an insect bite ending up with severe sepsis. And so whenever I approach a thing, I always keep in mind what would be the worst case scenario in that situation. But that is mixed with sort of sheer optimism and trying to not allow any negativity. So I keep these things in mind, and to not allow chances, sort of bad things from happening, we change what we're doing, we separate it and make sure that it's sort of we're safe from that perspective. Our family, I think in the first lockdown, people have taken things reasonably serious. However, I've not seen my family for the whole year, so I've stuck to lockdown since February. I've not met up with anybody over the summer. I have only in the later stages of this year, we started nursery again, although we obviously had a place secured all the way around, all year round. And all the sort of things like gym, swimming pool, and these things only started up recently before then lockdown obviously hit again. So we have literally minimized any social contact over the whole period of time, and we've been super cautious. We've not been traveling, we've not met up, we don't have anybody in our house, so we don't take our chances.
Okay, that's again, as a medical professional, it's not uncommon. I've spoken to many people who have taken that view, so thank you. What the next part, the second part, is origins of COVID-19. So what is your awareness on theories as to how COVID-19 has come into existence?
So I think one theory which was sort of promoted in the press was from the fish market, people eating dodgy food, and then the virus gets transmitted. Other theories probably originating from America are those that there was a myocarditis summit, and obviously the COVID virus causes a lot of myocarditis, and the sort of theories of that being produced in the lab. I don't think the media has followed either of those significantly recently, so I think that will come out in the coming years of where it came from and where it originated, although we can't change it now, so
no.
We might as well look in the future and try and get the pandemic under control.
100%. And what would you deem as trusted sources in terms of getting that kind of information specifically? Because you've touched on a couple of things that you're right, the media hasn't majored on or focused on. But just because it's not in people's daily news diet does not mean that it's something to consider and confirm or refute. So was this again Twitter that allowed you to kind of have a broad, diverse range of views that you would then filter down and assimilate into what's practical and useful now?
I think Twitter was very helpful because Twitter allows sort of a diverse group of people posting information, and then you can filter and review. I think most trusted resources for me would be medical papers. I know that Lancet and New England Journal of Medicine had to withdraw a couple of papers, but overall I think they're trustworthy sources. I wouldn't necessarily trust the sort of mainstream media because they are very much influenced by political issues. So I prefer the medical stuff.
Okay, and it's interesting you say influenced by political issues, because I think at the beginning of this, I found it quite odd that you'd have somebody standing at the podium in number 10, be it the PM, health secretary, whoever, talking to a pool of journalists that are sitting next to each other in the physical world. And I know, looking at a respiratory pandemic, that's probably not the best idea, but regardless, that's still happening. Then they're talking to us, the population, from the podium, but then there's this layer of journalists that are in between that are asking questions on behalf of the public, but those questions have a political stance and how much papers they sell or clicks that they get, and they're just looking to sensationalize something that really people want to know. They don't give a kind of two hoots as to what the clickbaity headline is going to be. They may be certainly from a subconscious level, they might have no option apart from being kind of enslaved to that. But generally, in the early days, if you go back to the press conferences, how do you think the information was transmitted from the press pool sitting in Downing Street asking politically orientated questions? How helpful was that for the public?
I think to judge that, you have to sort of define the public. I mean, the public are highly educated healthcare professionals and other people involved in health economics and so forth, but also the wider public who've got nothing to do and very little, if not no, understanding of how these things happen. So I think to make although I disagree with a few things the government has done and how the communication has happened, you also have to think about how they're communicated to 80 million people.
Mm.
And although I can see we've been isolated for many weeks, so why shouldn't we meet up with other people who have been isolated? You cannot say that to other people because they don't understand how transmission works.
Of
So
course.
I think the bland way of how they've done a sort of bland information for everybody, we're locked down, nobody's allowed to do anything, and of course they have to do certain sensational things because I think the wider public might not otherwise listen or watch the news. So it's difficult to judge them, and that's why I find it difficult to sort of engage and follow the sort of mainstream media when that is probably not they don't target me.
Brilliant.
They the wider public
Population.
people.
Yeah, thank
Population.
you. That's really good. And it's really interesting that you say about 80 million people and how do you get that messaging to that? And we've got some questions on that. So we'll pick up that thread in a minute. I think I know the answer to this one for you, but I'm going to ask you anyway. Does detailed knowledge of the science, bearing in mind this is for both professionals and non-medical professionals that are taking part in this, does detailed knowledge of the science behind COVID-19 help, hinder, or have no effect on your day-to-day response?
Well, for me personally, detailed science is a great importance in how I behave and why I do things. If you tell me what I should be doing, then I need to know why I should be doing these things. And if I understand the science behind it, I'm very happy to follow. But having interacted on that WhatsApp group and with many family members, although some of them are doctors, and some of them are sort of educated professionals, they still didn't understand the bottom line of, you cannot meet even though you're family. And
Wow.
so I think the greater science matters for those who want to understand them and want to follow them, but for some people it is too difficult to understand, and easy, straightforward information is more important.
Brilliant, thank you. Has your understanding of this increased, decreased, or stayed the same over the last 9 to 12 months?
My understanding of COVID?
Yeah.
Increase.
Okay. This has been widely described in the media as a once-in-a-century event. In your view, could an outbreak such as this happen again in our lifetimes?
Well, I think the last pandemic has been over 100 years ago, so it statistically is unlikely that's going to happen to many of us during our lifetime. However, the way we live, i.e. in crowded cities and with poor hygiene and in overheated buildings without ventilation, you almost wonder whether we're having a similar pandemic or infection, whether it's flu or coronavirus, in our lifetimes again. So I think unless we change the way we live and we treat ourselves and look after our health and our planet, I think it's likely that we might encounter this in the next 100 years.
Brilliant, thank you. Well, not brilliant, but you know what I mean. So number 3, the third and final part, and then there's a quiz, a picture quiz at the end. Subsequent pandemic behaviours. So 3-word slogans have been a big part of UK government communications. Are there any that have particularly resonated with you, and why?
Well, I think they have to keep it simple and face space. It rhymes, so it's good for people. I mean, I don't need these slogans. I know how to prevent spread of infection, so I don't need to sort of face space and these sort of the slogans in my life. But I think it's a good way of transmitting the information, and the general public will find it easier to understand.
Okay, no, thank you. So we'll come on back to that in a sec. The vastly varying way COVID-19 affects people has meant terms like shielding, asymptomatic transmission have become vital. What do these terms mean to you? So shielding and asymptomatic transmission.
Well, asymptomatic transmission is significant for children because very few children get an inflammatory response. So a lot of them will be infected in their household, go to nursery or school, and then bring it home without ever having any significant symptoms, maybe beyond a cough. And also, obviously, healthcare professionals who might have good health and transmit the virus without having any symptoms. Shielding, that's been a great discussion in this WhatsApp group, because I mean, I've been shielding, although I shouldn't have been from a health perspective. But I think shielding is staying at home and protecting yourself from any social contacts to get the virus, and some of those people in the WhatsApp group haven't quite understood that.
No.
Absolutely necessary to protect yourself. In
I
fact,
mean,
probably the only way to protect yourself.
100%. And I read some interesting things in terms of, if you look at demographics, socio-economic demographics, so you have, for argument's sake, very simplistically, say you have people that are poor, middle income, and absolutely loaded. And I know there's variations in between, and this is a sweeping generalization, but it was people that are very poor, that have difficult working conditions, that live in crowded, cramped spaces. It's very difficult for them to shield, or if they have to go to work and they have to go to a workplace that's not fit for purpose, then they can't shield. Yeah. There's people in the middle that are quite comfortable and can do that quite happily and will do that. But then also some of it's terrible, I can't reference it, and it was back in the early days of this, but we've seen it recently with the people that went off for skiing in Switzerland and then escaped, 200 of them, before they locked it down. And there's almost, because I talk to people from across the spectrum, right? Millionaires and absolute basic income and struggling. And sometimes people can, at the higher end of the income scale. So I got an offer from somebody who will remain anonymous, but they wanted me to be their personal physician and put me on a retainer for 6 months. This was in the months before, let's say kind of in February time, before the pandemic hit. Now, this person is quite influential, and I came into contact with them working at the private urgent care centre in London. So you've got to assume that they've got information that is not in the broader domain, and they're looking to use that information to protect themselves. So that's fine. But then and I hasten to add, I didn't take the offer because I'm completely not suited for that kind of medicine. I was flattered to be offered, but I can't ventilate somebody, I can't intubate somebody, I don't have my own ICU, so I would have been very little use. But there is that, what's the word, mindset where people think, oh, I've got loads of money, I can get medical care if I need it. But guess what? You can't. You seriously can't. You can't buy the vaccine. We've seen people wanting £20,000 to get a vaccine early. The urgent care centre where I work has shut at weekends, so you don't have that access to quick medical out-of-hours care. So I thought that was really interesting, and I think that might be a theme that we'll explore and develop and will come out of this. Have you got any comments on that, just before I move on to the next question?
Yeah, it's very interesting that you say that, because a friend of mine has had an angio a week ago, which showed severe three-vessel disease, and he requires a coronary artery bypass graft, which, with a severe left main disease, he should really have in the next couple of weeks. However, he's offered that by the NHS in the next couple of months, and as we all know, this is probably going to be 3 or 4 months. So now, with money not being an issue, he still can't get private coronary artery bypass graft, because obviously all the cardiothoracic surgeons are working in the NHS, and the cardiothoracic surgeons are not even the issue, but you need a cardiac anaesthetist, and they're obviously well suited to cover the intensive care unit. So now, with all the money in the world, I mean, not that he has it, but he's got the money to pay for it privately, self-funded, he cannot get a coronary artery bypass graft.
Yeah. I mean, back in March, I was concerned about medicine going into the dark ages. And I think it is. When you look at numbers in terms of hospitals are absolutely flooded with this. And you get people like, I think it's Richard Tice, is the Brexit Party chairman, going down to Excel with a 1-minute video saying it's empty. People will look at that 1 minute and then think, okay, then I'm going to go out and do stuff then. Look, it's fine. So I think people have got to be quite responsible about this and not use it as a way to get political leverage. But anyway, are you more likely to listen to a friend, expert, or celebrity when it comes to I think I need to add a new category for this one, really, to adopting behavioural modifications, keeping you or your loved one safe? Maybe expert, because you've said papers already, haven't you?
Yes, I think it's very important for me to understand the science behind it, and I don't think that certain members of the government, in fact probably all of them, have more insight into the science behind the virus than I have. So yes, I need to understand the reasons behind it, and that's the same with the virus as well as dietary advice. I mean, if you look at salt intake advice in cardiac people based on a very poor performed study, but we're all recommending it to everybody. So, you know, I need to read the science behind it and understand it, and based on that, I will change my behaviour or advice.
Cool, thank you. That's really good. Last couple of ones. When stories arose about people breaking the rules, do you think that helped, hindered, or had no effect on the public health response?
I think that had a response. I know a lot of people who broke the rules, including healthcare professionals, and we all know that some of the doctors had private parties or shared cars, and that ended up in the news. And I think, including those in the government who broke the rules, it's very important to highlight this, because there are significant people who suffered, who stuck to the rules. So I think I am a fan of being open, and I think it's important that we highlight the fact that people break the rules, and yes, it can be negative, because they might be in leadership positions and then people follow breaking the rules rather than sticking to them.
Cool, thank you. Are there any phrases or words that spring to mind about 2020 and the COVID-19 pandemic as a whole?
Well, it comes back to positivity, negativity, and their view on life. I think Twitter and all of my friends are all sort of said goodbye to a crap year 2020, and I don't share that view. I mean, we have demonstrated a huge amount of commitment to the NHS. The NHS workers and all the key workers have pulled together and made a huge difference. The fact that we've managed to get many vaccines and have them within a year, I mean, less than a year. I think the virus was first found in November, October, and the first vaccine was ready in November. So I think we've achieved, as a sort of a human race, we've achieved a great deal. And yes, we have suffered, and some have significantly suffered, but I think there are also very positive things to look back on. So I don't want to recap the negative phrase of bad 2020. I think we've achieved a great deal.
Brilliant, thank you. So the last part, and this is going to be really quick, I have no doubt, is faces and phrases of the pandemic. So I need to get them on slides properly and share them. I haven't done that yet, but who's that?
Oh gosh, Min Tang.
Okay, well,
the medical advisor, Professor the Min Tang, or what I don't know what his
Jonathan
name.
Van Tam, so Deputy Chief Medical Officer.
Yes.
Who's that one?
That's his deputy.
Yeah. So remember her name? Doesn't matter. Jenny Harries, Deputy Chief Medical Officer.
No idea.
Okay, Debbie Sridhar, Channel 4. Well, she's a global chair of public health, but this was an image from when she was on Channel 4.
That's a WHO chief.
Yep. Director General Tedros.
I don't know who that is.
Maria Van Kerkhove, she's the COVID-19 technical lead.
Don't know.
June Rain, sorry. She's the chief executive, I think, of the MHRA. Oh, that's different. That's just a picture of the world as a COVID virus. And then we've got, is that?
Oh, Cummings.
Very good, thank you. So then this one is, so do you know what, that's deliberately pixelated. Can you remember, this was from March.
Oh, that was the first slogan.
Yeah.
Save the NHS. No, so stay at home, save lives, save the NHS.
Okay, yeah, so stay at home, protect the NHS, save lives. And then this is the current one.
That's our face.
The yellow and green one. So yeah, there is face, space, and hand, space, space, test. But this is the yellow and green one before hand, space, space.
Oh, it's not stay at home anymore. It's that's when they changed it to stay safe or something. Oh, I don't know. It was stay at home and then changed it, which caused an outrage because people didn't feel they need to stay at home anymore.
Yeah.
So, save the I can't remember.
Okay, so it was. I could leave it hanging, but that wouldn't be very fair. I went to that. So it's stay alert.
Stay alert, yeah, because
Stay alert, control the virus, save lives.
yeah,
Um,
not very catchy, I guess.
no, but interesting. I mean, I think it shows the problem between balancing health and the economy, which has always been the thing throughout this. And if you look at the data for Eat Out to Help Out, that actually on Mondays to Wednesdays in areas where it wasn't raining during the pandemic, there was an 18% uptick in cases where Eat Out to Help Out was utilised in areas where it wasn't raining.
All right, okay.
But it kind of surprises you, doesn't it?
But I mean, that was a stupid thing to do anyway. But yeah.
Yeah, it is. So what I'm going to do is I'm going to stop this recording. Thank you very much for your time. I really appreciate it.
You're welcome.
So I'm going to just stop that there.